wetter and everything. Yeah, I too went to Max last week. Or Marks, I should say.
Okay, remember, we're reasonable people with reasonable concerns.
No, we're just concerned citizens. Concerned citizens, that's all.
I've just never had anyone come, so I'm just gonna go and let them know that it's gonna happen. Okay.
Thank you.
This is
All right.
Dave Burton from Haliburton.
Hands East.
Yeah. Dave Bridges.
Hi Dave, good morning,
Dave
mate.
Burton, Graham Hawkridge.
Yeah.
Carl Ratzik and Margaret Ratzik.
Hi.
This is from, this is Dave Burton. Yes, these people are all from Manvers.
Okay.
Our end of the city.
Yeah, the second.
A second here to get put back. We do have a notice of motion on the floor. Open it. Okay, I'll read the notice of motion so we can. Whereas the number of industrial wind projects proposed for Haliburton, Kawartha, Pine Ridge, HKPR jurisdictions, and whereas under Section 12C of the Health Protection and Promotion Act, the HKPR Board of Health has been advised of concerns with respect to adverse health effects of industrial wind turbines on human health, and whereas the ERT concluded that there are legitimate concerns and uncertainties about the effects of wind turbines on human health, and whereas the Environmental Review Tribunal of the Chatham-Kent Wind Project, Kent Breeze, concluded that further peer review science and on the association and causation questions would help determine that protections such as permissible noise levels and setback distances are required to protect human health, and whereas the ERT stated that cautionary measures should be taken to minimize the risk, and whereas the ERT found that there is challenges and uncertainties associated with predicting the measuring and assessing sound, including audible sound, low frequency sounds, and infrasound, and whereas the ERT stated that noise compliance measurement will be an important aspect of the implementation of the new renewable energy approval regime, and whereas the Ministry of Environment staff memos show concerns with the expedience of the noise levels, noise testing compliance, and recommended lower noise levels and increased setbacks to accomplish lower noise levels at noise receptors, and whereas the ERT found that evidence presented to the tribunal demonstrates that wind turbines can cause harm to humans if facilities are placed too close to residents, and whereas recently released peer review research indicated adverse health effects of industrial wind turbines on human health. Therefore be resolved that the Haliburton Kawartha Pine Ridge Health Unit supports the request for moratorium on industrial wind development until further clinical health studies have been completed by independent researchers to determine that protections such as permissible noise levels or setback distances are required to protect human health. Can I get a second?
Could you repeat that?
Yeah, all right. Moved by Heather, I know. So seconder on this one is Doug. Comments, questions on this?
Can I speak to it?
Okay, I've got Gil first, and then I'll go to you.
Okay, yeah, Mr. Chair, I mean, both you and I, as mayors of different communities, often come across notices or motions that that we don't always agree with, but get get passed anyway. And however, in our procedural bylaws, there is a point where business past business becomes past business, that we don't keep bringing it back in front of our respective councils. So my question to you is, when does this become finished business?
I'm hoping today, so unless something new comes up, today would be the last that we'll deal with it, or whether we move forward or backwards, I don't know.
My question is, we have dealt with it on 2 occasions.
Yes.
So I have been under the impression that it is finished business
This, after today.
after.
Unless something new comes up, Gail, that will change the direction of the board.
Okay, well, what I can tell you is I can support, reviewing, a review at 6 month intervals. I just don't understand why we're dealing with it month after month after month. Because if you deal with it at 6 month intervals, there may be some new information that is worthwhile dealing with, but there can't be new information every month.
Yes, and there's, unfortunately, I can tell you that there's nothing within our guidelines to state that somebody hasn't got a right to bring it forward every month, but there isn't in the health unit.
Okay.
There is in your own, you may have
So that was a
your own.
procedural question, thank you.
That's exactly right. Motion?
Yes. First of all, I want to make sure everybody understands, the City of Kawartha Lakes does have a number of renewable energy projects that it is going forward with. And this is not about being opposed to renewable energy projects. This is about doing due diligence with respect to these projects, given the circumstances that we're facing. These are, since the Environmental Review Tribunal took place, or since we met in June, rather, we have had an Environmental Review Tribunal. There have been 10 new peer-reviewed articles that have been published. Peer review meaning that they were put out there and they were reviewed by their peers. So this is not just, somebody stood up and said, I'm having a problem. There have also been, there's been the release of Ministry of Environment memos speaking to the fact that the Ministry of the Environment staff were concerned about the setbacks and the noise levels and made recommendations that were different than what were put forward in the regulations. There has also been a number of lawsuits that have come forward speaking specifically to the gag orders that are in the agreements that prevented people from reporting adverse health effects. We now know that information and we need to be aware of it. Is the Canadian Wind Energy Association, they also came out with a statement saying that they recognized that there was a risk, or that people can get sick. So there has been a lot of new information that's come out. There was a memo from Health Canada advising one of the wind companies that they had to report that there was peer-reviewed research indicating that there were adverse health effects. The World Health Organization has put out guidelines that were not on wind turbines. They were on road, rail, and aircraft. The important thing to remember there, that was the 40 decibel guideline. The important thing to remember there is that that was for noise that is abated at night. In other words, that noise level goes down at night. The recommendations from the science, one of the articles in Science, Technology, and Society by Bob Thorne, who is a specialist in this area, a peer-reviewed article, recommended a 32 decibel level. The Ministry of the Environment officers recommended 30 to 32 decibels. The the guidelines that are currently in place recommend 40. In fact, once they're generating any kind of electricity, they're at 51 decibels. And every single one of these projects will have reduced setbacks in place for these turbines. They have 15 turbines proposed in the area that's in Manvers. When we mapped out those turbines, we realized that they could not meet the 550 meter setback as it was. So in almost every instance, people will be facing higher noise levels. There are concerns associated with those noise levels, as well as the low frequency noise. And low frequency noise, much like ultraviolet light, just because you can't hear it doesn't mean it's not causing harm. There are a lot of adverse health effects reported associated with low frequency noise. They are recognized, and when the report was done by the Chief Medical Officer of Health, and it was shown at the Environmental Review Tribunal, the author of the report, who was Dr. Rahman, I believe, did say that the report was based on the direct effects. but they did not explore the indirect effects, and that is addressed in the World Health Organization's scheme of how you look at these things. There are concerns. We know low-frequency noise, which is emitted from wind turbines. We know that low-frequency noise does cause adverse health effects, and we know that at the levels that they are being emitted at, there will be problems. We are saying that we need to wait. There needs to be proper clinical studies. The Environmental Review Tribunal did speak to the fact that although all of the research that was reviewed at the time was not peer-reviewed, it did indicate there was a need to do more research. And we want these people to be safe. We know there's a problem. We know there are people in the area that have no choice but to stay there right now. They can't sell their homes. They have to be protected. So we're asking for a moratorium to be put in place until clinical studies of people who are living with these right now have been completed, and we know that there is not a problem. It should not be incumbent on the people who have to be living with them to have to prove that there is no problem. We should be adopting the same attitude that we take with respect to vaccines and medication, anything else, where we have to make sure that they're not going to cause problems before we go ahead and put them in place. Just a couple of the protocol that has been suggested here is that we follow the Health Canada vigilance programs, and that is the same program that we are using to report adverse health reactions to prescriptions, consumer products, vaccine, anything else. It continues for the product of the life of the product, and that's the protocol that we should be using in this instance.